You're over 60 and you ask yourself, how many times a week should I masturbate? Am I doing too much or too little? Today, I am going to reveal one of the most closely guarded secrets in the world of medicine. The perfect formula for the masturbation rhythm of men over 60. It's not just a number, it's a scientifically grounded protocol that protects the prostate, balances testosterone, promotes heart health, and even reduces the risk of Alzheimer's. And I guarantee your doctor probably never told you this. I am Dr. Lauren Hart, and I have worked for over 20 years in the fields of urology and endocrinology. I have treated thousands of men over 60, and they all have one common question. Doctor, is it normal to masturbate at this age? Not only is it normal, it is fundamental for your health, but the key is to do it at the right frequency and in the right way. Today, I will give you the formula for this. Carlos was a 65-year-old retired engineer. He had lost his wife 3 years prior and had remained completely sexually inactive since then. When he came to me, his prostate had enlarged so much that he was getting up 5 or 6 times a night to urinate. His PSA levels were dangerously high. I asked Carlos, "How long has it been since you ejaculated?" Embarrassed, he replied, 3 years. That was the problem. The prostate needs to ejaculate regularly. It's not a luxury, it's a necessity. The prostate is a walnut-sized gland that constantly produces fluid. If this fluid is not emptied regularly, it accumulates in the gland, causing inflammation and growth. Imagine a faucet constantly dripping in your house, but with a clogged drain. The water overflows and ruins everything, right? The prostate works similarly. Regular ejaculation keeps the drain open, but how often? Here is the magic formula. 2 to 3 times a week for men between 60 and 70 years old. 1 to 2 times a week for men between 70 and 80 years old. At least once a week for men over 80 years old. These numbers are not random. They are based on an 18-year study conducted by Harvard Medical School with 30,000 men. It was found that those who ejaculated 21 times or more per month had a 33% lower risk of prostate cancer. Miguel was 62 and had the opposite problem. He masturbated 2 to 3 times a day. "Doctor, am I an addict?" he asked. I explained that excess can also be harmful. Too much ejaculation consumes important minerals like zinc and selenium. It can reduce testosterone and cause chronic fatigue. We limited Miguel to 3 times a week. 2 months later, his energy increased, his sleep improved, and even his hair looked fuller. Now I will explain the incredible health benefits of masturbation after 60. 1. Prostate health. With each ejaculation, about 70% of the prostatic fluid is expelled. This prevents the accumulation of potentially carcinogenic substances. 2. Cardiovascular health. During orgasm, heart rate goes up and blood pressure increases and then falls. A perfect exercise for blood vessels. 3. Immune system. After orgasm, the number of white blood cells increases by about 20%. 4. Sleep quality. Prolactin and oxytocin, released after orgasm, promote deep sleep. Antonio, 68, was diabetic. His doctor had told him to avoid sexual activity. We did the opposite. I prescribed Antonio masturbation twice a week. 3 months later, his HbA1c had dropped. Insulin resistance decreased, and we were able to reduce his antihypertensive dose. Regular orgasm increases insulin sensitivity, reduces cortisol, and speeds up metabolism. But frequency is not the only thing that matters. The method also matters. Here are the golden rules for masturbation after 60. First, don't rush. Dedicate 15 to 20 minutes. Ejaculating quickly does not completely empty the prostate. Second, always use lubricant. With age, the skin becomes thinner and more sensitive. Dry friction can cause microfissures. Third, don't squeeze too hard. The so-called death grip, excessive squeezing, can permanently reduce penile sensitivity. Pedro, 64, had erectile dysfunction. He took Viagra, but it didn't work. Upon examination, I realized that Pedro had been masturbating with too much force for years. The penile nerves were so overworked that they didn't respond to normal stimuli. I taught him gentle touching, slow movements, and plenty of lubricant. In 2 months, the sensitivity returned, and he didn't even need Viagra. The timing is also crucial. The ideal time is in the morning. Testosterone peaks at this time. Morning masturbation provides energy and focus for the day. If you prefer at night, do it at least 2 hours before bedtime. The increase in prolactin after orgasm facilitates sleep, but doing it too late can disrupt the cycle. Francisco, 70, had chronic prostatitis. Antibiotics were not helping. I taught him masturbation with prostatic massage. Unlike common masturbation, as he approached orgasm, he would pause and massage the prostate, applying light pressure on the perineum, the area between the testicles and the anus. This technique empties the prostate more effectively. In 2 months, the prostatitis disappeared. Diet can enhance the effects. 1 hour before, eat foods rich in arginine. Walnuts, almonds, peanuts. L-arginine increases the production of nitric oxide and favors erection. To replenish zinc, consume oysters, red meat, and pumpkin seeds. For antioxidants, pomegranate juice, green tea, and dark chocolate. Alejandro, 66, had Parkinson's. His hands trembled, and he couldn't masturbate. I recommended a vibrator. Yes, it's not just for women. Medical vibrators stimulate nerves, increase blood flow, and facilitate orgasm. Alejandro was embarrassed at first, but he tried it and not only got sexual satisfaction, but his tremors reduced. The release of dopamine during orgasm temporarily relieves Parkinson's symptoms. Couple dynamics also matter. If the relationship has cooled, masturbation can save the relationship. Regular ejaculation keeps desire alive. Be honest with your partner. Masturbate together. This preserves intimacy in old age. For widowers, masturbation is vital. After a loss, the sexual system must continue to function. Otherwise, the use it or lose it rule applies. Rodrigo, 72. His partner had Alzheimer's, and their sex life had ended. He feared masturbating out of guilt. "It feels like betrayal," he explained. I explained, "It's not betrayal. It's a health necessity." With regular masturbation, Rodrigo emerged from depression, improved his prostate health, and even gained energy to care for his partner. There are also technical variations beyond the classic manual movement. Pillow technique. Pelvic movements between soft cushions. A sensation closer to sexual intercourse, and it works different muscles. Shower technique. Stimulation with a jet of warm water. The pressure has a massage effect. Prostatic stimulation with a finger via the anus or with a prostatic massager. More intense orgasm and complete prostate discharge. Manuel, 69, was no longer satisfied with classic masturbation. I suggested he try different techniques. Manuel discovered prostatic stimulation. "Doctor, I've discovered what I was missing for 40 years, he said. The prostatic orgasm is different from the penile orgasm, deeper, longer. It involves the whole body, and most importantly, it completely empties the prostate. Some situations require attention. Hart. Orgasm accelerates heart rate. If climbing stairs is already difficult, consult your doctor. Hypertension. Orgasm causes a temporary peak in pressure. Take your medication regularly. Diabetes. Penile sensitivity may decrease. Longer and more careful stimulation may be needed. Juan, 71, had heart disease and had a bypass. He completely avoided sexual activity. We spoke with the cardiologist. We allowed masturbation at a gentle pace, without stress, keeping his HR below 120 BPM. Juan returned to feeling satisfaction without fear of a heart attack. 6 months later, even his cardiac function had improved. Regular, controlled sexual activity is exercise for the heart. The psychological aspect is also crucial. Many older men feel guilt. They say, "At this age, it's shameful. I feel like a pervert." This is totally wrong. Masturbation is natural and healthy at any age. Don't judge yourself. It is a bodily necessity, as natural as breathing or eating. Sergio, a 67-year-old retired professor, considered masturbation a sin due to religious beliefs. His prostate had grown so large that he needed surgery. I explained the medical facts and recommended he talk to a religious leader. He heard, "What is done for health is not a sin." Sergio felt relieved and began to masturbate regularly. Surgery was not necessary. Interactions with medications also matter. Antidepressants can make orgasm difficult. If you can't ejaculate, masturbate anyway. The stimulation is still beneficial. Prostate medications can affect ejaculation, e.g., retrograde ejaculation. Semen goes into the bladder. It is not harmful. Continue. Antihypertensives can affect erection. It is possible to masturbate even with a partial erection. Ricardo, 73, was taking 5 medications and couldn't get erections. "How am I going to masturbate?" he asked. I taught him masturbation with a flaccid penis. Even without a complete erection, it is possible to achieve orgasm by gently caressing, rubbing, and squeezing. Ricardo was surprised. "I can ejaculate without having an erection." Yes, the neurological pathways can function differently. Seasons also influence. Winter. Testosterone tends to drop, desire is reduced. Don't force yourself, but do it at least once a week. Summer. Testosterone rises. It's normal to have more desire. Autumn. The prostate tends to enlarge, so regular ejaculation becomes even more important. Spring. Hormones fluctuate. Maintaining rhythm brings balance. Diego, 66, suffered from seasonal depression in winter. Sexual desire disappeared. I gave him a winter protocol: vitamin D, morning sunlight, and mandatory masturbation once a week. At first, he saw it as a chore. Over time, his winter depression alleviated, his energy returned, and by spring, he felt much better. Hygiene is fundamental. Clean hands always, short nails. Aging skin has a higher risk of infection. Use a water-based lubricant. Oily products favor bacteria. After masturbation, wash the genital area. Risk of urinary tract infection. Use a personal towel. Risk of fungi. Pablo, 70, had recurrent urinary tract infections. I asked about his hygiene habits. He was using olive oil as a lubricant and wasn't washing afterward. A perfect environment for bacteria. We switched to water-based lubricants and strict hygiene rules. The infections disappeared. The combination with exercise yields excellent results. Before masturbation, light stretching increases blood flow. Kegels prepare the pelvic floor. Deep breathing improves oxygenation. Afterward, a light walk eliminates metabolites. Yoga deepens relaxation. Meditation prolongs the effect of orgasm. Fernando, 68, was a former athlete who became sedentary after retirement. His sexual functions worsened. I gave him a protocol. In the morning, 20 minutes of walking, then masturbation, followed by 10 minutes of yoga. In 2 months, Fernando looked 20 years younger. "Doctor, I feel like an athlete again," he said. Timing your meals is also important. Avoid heavy meals 2 hours before. Blood goes to digestion and hinders erection. 1 hour before, a handful of nuts, arginine source, a glass of pomegranate juice, improves flow, and dark chocolate, increases endorphins. Afterward, a protein snack accelerates recovery. Drink water to prevent dehydration. Banana helps with potassium. Ignacio, 71, felt very tired after masturbating. I reviewed his food diary, skipped meals and poor diet. We created a plan with proteins and complex carbohydrates, especially on masturbation days. The fatigue disappeared, and he started to feel more energetic afterward. Technology also helps. Electrical stimulation devices, TENs, for the penis and perineum. Prostatic massagers with or without vibration, internal stimulation. Virtual reality glasses, visual stimulation, useful if imagination has weakened. Smart masturbators, temperature, vibration, and pressure control. Louis, 69, couldn't use his hands due to arthritis. Masturbation seemed impossible. I recommended an automatic masturbator. He joked, "I'm going to have sex with a robot." He tried it, and his life changed. "Doctor, it's better than what I can do with my hands." Technology can provide sexual freedom in old age. Adaptation after the loss of a partner can be difficult. After 40 years together, masturbating alone can feel strange. It is normal to feel this way. Start slowly. You can look at a photo of your partner. Don't feel guilty. She would also want you to be happy. It's a chance to discover new techniques. Arturo, 74, lost his partner to cancer. He went a year without sex. "It feels like betrayal," he said. We recommended therapy. The therapist said, "Your partner would want you to be healthy and happy." Arturo started slowly, once a month, then once a week. 6 months later, he said, "I feel alive again." The concept of group masturbation may sound strange to older men, but it can help. It is not necessary to do it together physically. There are support groups where men share experiences, teach techniques, and reduce guilt. There are also online forums with anonymity. Ramon, 67, felt very lonely and wasn't enjoying masturbation. He joined a sexuality forum for older men, read stories, and shared his own. For the first time, I didn't feel alone. He exchanged techniques with colleagues and gained motivation. The combination of meditation and masturbation is powerful. Tantric masturbation, delaying orgasm and diffusing the energy. Conscious masturbation, focus on the present, letting go of thoughts. Breath-focused masturbation, with each breath, attention to a different zone. Chakra masturbation, activating energy centers. Gabriel, 72, a yoga teacher, combined masturbation with spiritual practice. He did 45-minute sessions, controlled his orgasm, and spread the energy throughout his body. "It's not just ejaculation, it's a vibration of my entire being," he said. Gabriel's prostatic health is excellent, and his energy level is that of a 40-year-old man. Non-drug solutions for erectile dysfunction. Vacuum pumps attract blood. Penile rings retain blood in the penis. Injections provide direct erection. Implants can be a permanent solution, but try natural methods first. Nicholas, 70, couldn't get an erection. Viagra didn't work. We tested the penile pump, the first time he got an erection and then masturbated. For the first time in 10 years, he vibrated. The pump plus masturbation combination keeps penile tissue alive. Adaptations as you age. Conclusion: masturbation after 60 is not just pleasure, it is a health necessity. The ideal frequency is 2 to 3 times a week, supported by correct technique, hygiene, and nutrition. Don't feel guilty, don't be ashamed. You are attending to your body's needs. Sexuality is natural, healthy, and necessary at any age. My last case is Esteban, 77. He had overcome prostate cancer. His wife had passed away, and he was depressed. "What do I have left?" he asked. We started a masturbation protocol. He resisted the first week, tried the second, and in the third, he said he felt alive. 6 months later, he enrolled in a dance class, found a new partner, and said, "Life begins at 77. What will your story be? Start tonight. Set aside 20 minutes. Prepare the lubricant. Be slow, gentle, and patient. Listen to your body. Continue. Even if orgasm doesn't come, it's a journey, not a destination. Each session will make you healthier. Remember, masturbation is not a luxury in old age. It is a necessity. For the prostate, for the heart, for the brain, for the soul. Give yourself this gift. Don't put it off until tomorrow. Start today. Your body will thank you. You have the right to a healthy, happy, and satisfying old age. And now you know how to get there.